And good morning again. We want to go first to Atlanta and the CDC Director, Dr. Tom Frieden, for the latest on this new case of Ebola, which was confirmed in Dallas overnight. Doctor, thank you so much. The authorities at the hospital are saying that the person who has now been diagnosed as having Ebola was a healthcare worker. They don't give the gender, and was exposed to Duncan, the man who died down there, on his second visit to the hospital. Obviously, he was showing symptoms by then, but that the worker had been considered at that point in a low-risk situation, and they say he was following CDC protocols. In other words, wearing the gown, wearing the gloves, and all of that. Doesn't this make this even more serious than we thought it was?
We're deeply concerned about this new development with a preliminary positive in a healthcare worker who cared for the index patient in Dallas on multiple occasions after his diagnosis. I think the fact that we don't know of a breach in protocol is concerning because clearly there was a breach in protocol. We have the ability to prevent the spread of Ebola by caring safely for patients. The fact is that the individual who became ill was, as per protocol, self-monitoring. Immediately when they developed symptoms, they isolated themselves. They were promptly isolated at the hospital so that any further spread from that individual was stopped. And fundamentally at this point, there are four things that we're doing. First is to make sure that that individual is cared for safely and effectively. Second, we're identifying that individual's contacts, and our CDC team lead for this investigation on the ground in Dallas interviewed that individual in detail. Third, we now consider all of the healthcare workers who cared for the index patient potentially to have been exposed, and we'll be rostering those individuals and determining which require active follow-up in addition to their self-monitoring. And fourth, we'll conduct a full investigation of what happens before health workers go in, what happens when they're there, and what happens in taking off their protective equipment, because infections only occur when there's a breach in protocol.
All right, let me just make sure I understand what you're saying here. Are you saying that somehow or another, by accident or otherwise, that one of the protocols was violated or not followed? And that's how this happened, not because there are other ways that you can get this disease. Is that basically what you're saying, Doctor?
That's correct. We know from many years of experience that it's possible to care for patients with Ebola safely without risk to healthcare workers, but we also know that it's hard, that even a single breach can result in contamination. And one of the areas that we look at closely are things like how you take off the gear that might be infected or contaminated. Another that we'll be looking at closely in the investigation is the interventions that were done to try desperately to keep the index patient alive. This included dialysis and intubation. These are two procedures which can result in the spread of infectious material.
And how many of these workers are you now monitoring, Doctor?
We're now looking at all individuals who cared for the index patient, and we'll be determining how many of those may potentially have had contact that would have resulted in a breakdown of protocol and possible contamination.
But I mean, approximately, is that 24 people? Is that 10 people? How many people are you monitoring down there at that hospital?
Yeah, I can't give you an exact number. These are late-breaking developments. We got the preliminary positive test last night, less than 12 hours ago, late last night, and our team is intensively working with the hospital on both understanding what happened, identifying other healthcare workers who may be at risk, and also making sure that protocols are followed in the care of this individual.
Doctor, let me ask you this, and I'm asking you just because I'd be interested in to know. It seems that the authorities are being very secretive, as if they were dealing with top secret information or something like that. I just wonder, there must be a reason for that.
I don't think we're being secretive at all. Within 2 hours of the index patient being diagnosed, we had a press conference. Late last night, we heard of this patient's preliminary positive, and we're speaking to the press now. We want to give more rather than less information.
I understand.
We also want to make sure the information we give is accurate.
I don't mean this as criticism, but I mean the fact that you can't even tell if it's a man or a woman. There must be a reason that you're withholding that information.
You know, we really try to protect individual patient confidentiality. So sometimes that may seem excessive, but if you were sick or a family member were sick, you'd really want the information coming from the individual or family. There may be coworkers who would be able to identify who the individual is if they knew the gender. So, you know, we would rather err on the side of safety and the side of respecting and protecting patients.
Doctor, thank you very much, and we certainly appreciate your taking your time to talk with us this morning. Thank you.
Thank you very much.